Hi everyone, Dr. Emmy from Pain Free and Fit. Today, a great video for those of you learning how to bend safely without pain with your degenerative, herniated, and bulging discs. Hope you enjoy. So learning how to bend with disc problems in your lower back without aggravation is all based on maintaining a neutral spine and bending from other joints besides your lower back joints. You begin with determining a few basic ideas of what a neutral spine is. That's going to be different for each person. You can start by thinking about your pelvic tilt position or level of your pelvis. If you roll your pelvis so that you lower your pubic bone and raise your tailbone, that will increase the arch of your lower back. That's anterior pelvic tilting. I'll do that slowly until I come to the point where I start to notice some discomfort. That would be one extreme. I then would do the reverse and go into a posterior pelvic tilt where I tilt my tailbone under and my pubic bone up. As I do that, I go as far as I can, flattening the arch of my back until again I begin to feel a little discomfort or a little tightness or a pull in my back. That would be the opposite extreme. Thus, the neutral spine is the mid position between those two extremes. It's the point where it's the furthest away from either side that's going to be irritating you. That's what you're going to hold as you bend. You can also think about engaging a lateral motion of your spine to determine where your problem is. If you bend your knees slightly and swing one hip up and then the other hip up, same thing. Go as far as you can until you feel a little discomfort. Mark that as one extreme. Swing the other hip up. Figure out where the discomfort is. That may be another extreme. Place your pelvis right in the middle or neutral between those two extremes. Most of the time, that's a level pelvis. You can check rotation by twisting your hips slightly to the right and to the left. Same theme. If I start to notice this discomfort one way, I'll then switch the other side and see if there's discomfort another way. Again, I want to go to the mid position. Usually, but not always, that'll be with your pubic bone facing straight ahead. Those with sway back postures may need to set the pelvis in terms of a forward and backward slide. If I slide forward with my hips to a point where I start to notice an irritation on my back, that's one extreme. Slide backwards until I feel something else, that's another. Again, I want to put myself right in the middle between those two extremes. Likewise with my chest, I can move it forward and backward and feel how that affects my lower back. I want to choose the middle. I can likewise use my chest to slide right and left and my pelvis to slide right and left. That's different than our first, moving up with the hips. That's a lateral glide or lateral translation. The idea is I want to use my pelvis and my rib cage and my arching of my back to determine where my middle position is. Combining all of these to the point where I hold that middle position, I'll then start to bend. So there are a few different options in bending once we get our neutral spine position in the ideal middle position to protect ourselves. Number one, we can use a lunging motion where I have one leg forward and one leg back, and that's by bending my knees, my hips, how I get down to pick something up or to pull something. If I need to get really low, I'll have to get my leg back. Again, I'm not losing that neutral spine. As I'm bending, I'm maintaining that exact middle position in all those different planes of motion that I've set. And hopefully I'm using the correct muscular tensions in my core, such as my multifidus. If I'm weak with the multifidus, I want to make sure I activate that. If one side of my abdominal muscles is overactive, I want to deactivate that and activate the other side. That's another topic. We've covered that in other videos here on the channel that you can check out. But suffice to say, I want to hold that perfect neutral position with all those core muscles properly engaged as I move and then pick something up. If I have a problem with a hip or a knee, I may choose to bend with the other leg back to do the same thing. Now from the lunge position, I could also grab something sideways. A lot of times with disc problems, there's more of a problem bending forward and backward. And even in a neutral spine position, you may at the beginning have a tendency to lose that. So side bending from a lunge position to pick something up is a lot easier. I can also use a stiff-legged deadlift type motion where my knee is slightly bent to relieve my hamstring stretch, and I'm going to pivot forward on my hip by maintaining that neutral spine and pivoting my whole body, my ear through my ankle on my back side, in your view, will move forward in one line as I pivot forward. Now as I do this, it's important to really get that back leg back and high so it follows your upper body, so that line is straight, And as I do that, I haven't lost that neutral spine position in my back. All the motion is in my knee and my hip, and I can grab something. I can also use a squatting technique. Whether I use a parallel hip squat, where my feet are straight ahead, I maintain that neutral spine. And again, by moving the hips backward and pivoting from the hip, my whole upper body is folding forward on my hip joint. Right there, I'm going to be able to pick something up. Now, this is probably the one that's going to be most dangerous, especially if you have acute low back disc problems. So I would advise those other two lifts instead. However, if you use a sumo squat, where we widen our stance, having the feet slightly pointed outwards, I can come down. Now I'm not as forward with whatever I'm lifting. It's more in line with the center mass of my body, and it's easier as I maintain that neutral spine to pick something up without aggravating my back. In a forward parallel hip squat, the weight is more forward from my center of gravity, and that produces a lever arm or stress into my back. The muscles in my back are more likely to tense strong to pick that up, and they can compress the disc, especially in an acute condition. So plug these techniques into your daily activities of bending and moving, maintaining that neutral spine not only when you're bending, but also when you're changing position, getting up and down out of a chair, rolling over in bed, getting in and out of the car. It'll go a long way to help protect your back from future injury. If you've enjoyed this video on bending down with low back disc troubles, feel free to subscribe to our channel. We got a lot of great videos on exercises that help strengthen your core, figure out your body mechanics, and get you pain-free and fit with your disc problem. Give me a thumbs up to share this valuable information with others. And remember, if you're looking for a great program of how to analyze your body mechanics, build your own self-rehab program, and get back into working out without hurting yourself with degenerative herniated and bulging discs, check out our Fast Track program for degenerative disc disease, available at painfreeandfit.com. I hope this video on bending with lower back disc troubles helps you with your chronic low back pain.